Without further ado, we'll give the floor now to Pantelis Tzamalis, who got his PhD from the Computer Engineering and Informatics Department at the University of Patras in Greece. During the last years, he has taken on the roles of senior research engineer, product technical manager, and systems architect in various projects at the Computer Technology Institute and the University of Patras. His research interests include artificial intelligence, and also the Internet of Things, crowdsensing platforms, healthcare, social media mining, and large-scale scenarios. Pantelis, the floor is yours.
Anna, thank you very much for the introduction. Can you see my presentation, everyone?
Yes.
Okay, let me proceed to this one. So, hello to everyone, and thanks for being part of this webinar. Today, I'll present to you how the exploitation of the crowdsourcing and crowdsensing can lead to the efficient monitoring of the disease's exacerbation. Of course, I want to thank ITU and Bournemouth University for the invitation to this webinar, as well as Dr. Lee, Dr. Angelopoulos, and Dr. Raptis for the great presentations. Firstly, I have to say that the next slides contain a part of our team's work over the last 3 years. So, who we are? We're a research team based on the University campus of Patras in Greece, and which deals with IoT solutions in various European and national research projects. To start with my presentation, healthcare has done some serious improvements over the last years by integrating technology into the domain of monitoring citizens' health, diseases, and their corresponding treatments. However, many solutions are still in demand for many domains of healthcare. For that purpose, IoT devices have been developed regarding the monitoring of citizens and especially patients' health. On this slide, you can see some examples of IoT applied to this domain. Nevertheless, these applications are made for personalized only health monitoring, as you can see. However, one interesting health monitoring scenario has been conducted by Aura, a company that has produced a smart ring which can collect recordings regarding various vital signs. The R&D department of Aura used these recordings to extract knowledge based on COVID onset on a citizen's health, and by notifying her, could mitigate the virus exacerbation in a spatial region. Well, now, there are a plethora of diseases nowadays that cause many impacts on people's life, and scientists around the world are working hard in order to monitor and prevent exacerbation of these diseases. Through this presentation, we will see how we can monitor a specific disease, allergic rhinitis. However, this solution we currently present to be generalized in the future and used for the monitoring of other diseases too. Why we selected allergic rhinitis? We selected this disease because it is among the most common diseases worldwide and has a huge impact on citizens' lives, as well as it affects their daily activities. Thus, it is important for the patients to be informed when the disease exacerbation occurs. They can that way better control their symptoms, identify where symptoms can occur, or assess the exposure to allergens that cause the symptoms in various areas. Allergic rhinitis symptoms mainly occur via pollen grains, which are airborne over long distances and are correlated with various environmental factors like humidity and African dust. These symptoms, as we mentioned above, lead to discomfort, thus there is a high need to disease prevention. Regarding this, some of the questions are, how can we prevent and notify patients with a disease exacerbation when a disease exacerbation is occurred in a region, especially in real time? Is there a way to monitor the disease passively without asking for the citizens' explicit contribution? How can we result in effective patient adherence to the treatment? Well, there is a solution. We can exploit the power of the crowd and the leaps in technology nowadays, both in hardware and software, as Dr. Angelopoulos and Dr. Raptis mentioned before. Specifically, in our work, we use the technologies of IoT, crowdsourcing, crowdsensing, as well as the emerging domain of artificial intelligence through which we can extract valuable knowledge. We also use smart wearable devices and automation mechanisms for the data collection process, and as a conclusion, in collaboration with the usage of the aforementioned technologies, we developed a platform that can monitor the disease in large spatial regions in real time. In our deployment, these technologies collaborate with each other to achieve better mining regarding the phenomenon. Various sources give inputs to the platform, as we can see later on. Thus, we stepped into the monitoring of the disease, and we can warn the citizens about its exacerbation, not only on a micro-scale scenario, which is, in our case, is an individual, but also on a large scale, meaning a population that lives in a huge spatial region, such as a city or a state or even a country. It is worth mentioning here that our study took place in collaboration with recognized doctors to achieve valid results. As you can see in the upper figure on the right, some applications in the past have placed and installed IoT devices with embedded sensors to gather information regarding pollen nonsense around the United States. However, these devices are expensive and difficult to maintain. Additionally, as you can see in the figure lower right, these sensors are sparsely placed in the US. Thus, we cannot gain full and detailed coverage of the allergens levels in the whole country. Moreover, there is an absence of information regarding the irritants that correlate with allergic rhinitis, such as humidity and African dust. The monitoring of these irritants is also interesting, as climate change and other atmospheric conditions are associated with them. In our work, as a case of study, we deployed our platform in the US. Someone could ask, why the USA? Well, it is the first country that deployed such sensors, so we can compare our results, and almost all the citizens use the same language. Our smart platform is developed based on the ITU standards, and it achieves holistic disease monitoring by utilizing the information from two components. The first one uses information from the crowd, both explicitly and implicitly. It relies on a hybrid utilization of crowdsourcing and participatory sensing. A mobile crowdsensing platform is a part of this component, as well as a mechanism that analyzes information from social networking services. Furthermore, the collaboration of human and machine intelligence finds a special role in this component. On the other hand, the second component, as you can see on the figure, utilizes only machine intelligence via the exploitations of sensor data from wearable devices. Consequently, the two components accomplish a complete sensing paradigm for efficient disease monitoring, which yields better decision-making by both the individuals and authorities, or even organizations, which can be the end users of the platform. Finally, the relevant stakeholders have access to this knowledge through a web application which embeds an easy-to-use user interface. The users have also the ability to use the platform's user interface through our cross-platform web application, where access is achieved by any smart device. By describing the first component in more detail, we can see from the figure on the right that it collects information that originates from various heterogeneous sources. The first type of inputs is subjective. Specifically, the data comes from the MCS system, a mobile crowd sensing system, where the users participate in the sensing paradigm by recording information relevant to a personal assessment regarding their symptoms through a tool which is called visual analog scale, or in other words, VAS. For each VAS recording, the date time along with the location information is stored into the database for that recording too. Correspondingly, the objective inputs come from the sensors measurements regarding pollen and humidity levels around the United States. The large-scale sensing is also achieved by utilizing implicitly users' public-only posts on Twitter. Moreover, it is worth mentioning that only tweets that contain keywords or hashtags related to allergic rhinitis are collected through the Twitter streaming API. Afterward, multiple analysis takes place in the main analysis engine, and valuable knowledge is extracted. First, the stakeholders have access to spatiotemporal representation of the sensing scenario, both for all the sensing forms and for each one separately. Secondly, various stats are exported regarding the distribution of the symptoms that occur and the allergens that affect the citizens in allergic or by checking the allergy onset through the domain of time. Thirdly, personalized information regarding the user's health is extracted. Finally, I have to say that as the user's privacy is our priority, the data is analyzed and presented anonymously. You can see the vast tool as I mentioned before on the right. Now, regarding the main analysis engine, we can say that it is the core of the component. It uses various pre-processing methods, statistics, and AI to achieve successful knowledge extraction. The most complicated procedure is, of course, the analysis of the Twitter posts. Our goal is from a pool of tweets to recognize only the allergic rhinitis related one. For that purpose, we use natural language processing and AI for the text mining, as well as some other processes for the tweets localization, so we can present them spatially. In the AI part, we deployed, tested, and validated various ML models. The best model reached almost 92% of accuracy. We then combined the quantitative social media information with the qualitative data inputs by using some advanced mathematical equations. Thus, each component complements the other in a hybrid manner, even in the case of the absence of one or more of the rest of the ones, and as a conclusion, the full spatial coverage for the disease monitoring is achieved. The first part of the results is the complementary sensing paradigm, which you can see in the figure on the right. Now, indeed, the monitoring is on a large scale and in real time as we aim. This information is accessible via our user-friendly interactive maps. Moreover, as you can see the pie charts on the right, the distribution of the allergens that mostly affect the users is extracted from social networking services, as well as the most common allergic symptoms. Fatigue and wheezing are on the top of the list of the symptoms. On the other side, mold, ash, and ragweed are on the top of the allergens list. The time series plot below depicts also the allergy exacerbation in the United States through time, while the sensor measurements give us the opportunity to extract knowledge regarding humidity levels across the United States. An additional feature of our platform is a motivation system that keeps the user informed about her allergic status. Specifically, provides information about the user's health status regarding the symptoms, together with a map indicating where the symptoms occurred. The information is extracted from the recordings of the VAS tool. We can say that this feature works as a kind of a motivation mechanism too. The users keep to being active in the sensing process since they are aware of their health, while the efficacy related to the adherence to the treatment can be also achieved. However, the most interesting part is, how can we achieve the monitoring of the disease passively? Generally, it has been observed that the most of the users get easily tired by the explicit participation process. So, can we get information about users' allergic status continuously? Well, the answer can be found in the usage of smart wearable devices like smartwatches or wristbands. In a nationally funded project where we collaborated with a recognized allergologist, we found that the most of the users do specific gestures during the allergic symptoms period. We also noticed that these gestures have particular patterns. Thus, we decided to do a huge step and promote the sensing procedure at an advanced level through the usage of AI for developing a human gesture recognition system. We collected a variety of identified gestures using the wristband you can see on the right. The wristband particularly integrates the post-BMI IMU sensor and has the ability to record the acceleration and the angular velocity of the wrist's movement in the 3D axis. Specifically, the acceleration is measured with the usage of an accelerometer and the angular velocity with the gyroscope accordingly. Because of the COVID exacerbation, we had also to develop a novel web application for the supervised by the doctor's remote recording of allergic gestures. I have to mention here that the data collection process in order to train our algorithms took almost 2 years. The data flow of the second component can be seen on the right. It embeds advanced AI-related processes, meaning the whole procedure from collecting the raw data and transforming it in an appropriate form for the successful training of the ML models. As we all know, the most effort in an AI problem is the data itself. Regarding the COVID restrictions, we had to carefully collect the data so it does not include so much noise. Afterwards, several techniques are applied for validating the collected gestures and then cleansing of bad data. Before the data enters the AI engine, we had to further process it. Thus, we split the data into train, validation, and test sets, and we augmented the trained data only with using advanced data augmentation algorithms for time series in order to permutate the axes, time warp the signal, and other methods. Afterward, we removed the noise in high frequencies. We removed the gravity component in order to extract the actual acceleration from each gesture. We calculated the energy for each of the sensor signals, and we finally scaled all the produced time series values to be at a particular range. Then the data is ready to insert into the AI engine. Various complex and very deep neural network architectures were tested, while the final evaluation of the models took place on real-world scenarios. So in that way, we can be sure that our processing sequence, the best model, and the corresponding parameters work well in a real-world application. This is a very important step, as our application is a risk-sensitive system, since it is related to patients' health. In this slide, you can see a real-world scenario where the user does a daily activity, in this case, writing on a laptop, while at some point, some executes the allergic gesture. You can see this in the left figure where the gesture is marked with purple color. In the figure on the right, you can see that our algorithms indeed recognize the allergic gesture with high precision of 100%. The model is really confident regarding this gesture. We evaluated also our models to other real-world scenarios, and we achieved an accuracy of almost 90% in various allergic gestures recognition, which is really promising for the future. As the future work now, we aim to optimize our models and the relevant data processing sequence. We want to gather more data to increase the variety of the allergic gestures, as well as containerize the platform so it can handle problems in large-scale scenarios. As you can imagine, the future of digital healthcare is promising, and these are some of the first results of the upcoming possibilities. Our presented platform has the potential to be modified and work for other diseases monitoring too. Our aim is to transform the medical examinations from hospital-centric to home-centric and achieve proper and timely diagnosis in order to improve the way patients' quality of life. Additionally, the power of the crowd can lead to valuable results that can help decision-making for both individuals and authorities or organizations that use such mobile crowd-sensing platforms. As a consequence, we can in the future achieve remote medical assistance and improve of the hospital operations management in case of disease exacerbations. Finally, this kind of solution can lead to a positive economic impact by reducing the loss of working hours and maintaining the productivity of patients with respiratory allergies. Here, you can find the relevant publications regarding the presented work. Thank you very much.
Thank you very much for this presentation. It was very insightful to hear from all of you panelists regarding such a variety